newspaper review, and I would imagine, and I know someone who's been struck by it, and it is particularly horrible. You listening now may have had it, or you may know people who've been affected by it, possibly even some of these hospital wards. I'm talking, of course, about the Norovirus. 750,000 people in this country now have been struck down by the winter vomiting bug. Hundreds of hospital wards have been closed, 335 at the last count in England and Wales, and now even some schools are being closed as well. It is the worst start to what's called the Norovirus season ever. In the past 2 weeks alone, 43 hospital wards have closed to new patients following cases of the highly contagious virus. Several schools have been forced to close after between a quarter and half of their pupils fell ill with it. And of course you do know with youngsters, with children, they're in such close proximity with each other. As soon as one of the little kiddies gets it, it's going to go around the classroom like the proverbial wildfire. Even businesses now reportedly have been affected by the outbreak. The Health Protection Agency put out figures yesterday, and they showed some 68,000 of us were hit by the bug in the first week of December alone. More than two-thirds as many people have been affected so far this autumn, compared with the same stage in 2011. It is, as I've said, the biggest early season outbreak of norovirus ever, which ultimately is spread by poor hand hygiene. The figures go back some years. During a typical winter, around 2 million people get it, but infections normally peak in January and February. This winter it struck remarkably early, which could, some people say or fear, herald a record season of cases. Well, we'll speak to someone involved in the treatment and diagnosis in just a second. Let's speak with a teacher, or indeed a head teacher, who's having to cope with this. Paul Jordan is head teacher at Thames View Infant School in Barking. Joins me now. When did the first first kiddie bring it into the school, do you reckon, Mr Jordan?
Oh, call me Paul, Nick.
Okay,
good morning.
Good morning, Paul.
It's passed in our school. We track our attendance very carefully, and for us, it was probably in October and November. There were a few children that were vomiting and had some diarrhoea, and we dealt with it very carefully and raised the profile of it with the children, talked carefully with the parents, and then it faded out.
So what does a school do when faced with that, when you first get the inkling that you've got 2 cases and then before you know it, it's half a dozen, then it's double figures? What should a school do?
I think they've got to be very responsive. I think parents and teachers should be, within the school, the head teacher should be monitoring attendance, should be looking very carefully at what's going on, and act proportionately. So for us, it was about working very closely with the families, finding out what was going on, making sure the children were sent home, raising hygiene awareness with the children. Mine's an infant school, so it was catch it, bin it, kill it. Remember that?
Yes,
Catch it, bin it, kill it.
Yep, of course.
And then we also we did things like family cooking, and it was wise to postpone that for a couple of weeks just to let things die down, and then making very, very close contact with those families while the children are ill.
Yes.
Making sure we say when they're dead, they're in bed. I know it's not a nice phrase, but when they're really dead out to the world, they're at home. And then it's working closely with those parents and encouraging the children to come back when they're feeling better.
Paul, have you worked out a figure, a percentage of pupils who you reckon got it over the season?
Yeah, we had percentages, no. Not this early hour in the morning, Nick. Apologies for that. But I've got 438 pupils, and altogether there was 36 children that were poorly during that period. And I don't know if that was the norovirus, it was vomiting, and it was sickness. The staff was affected too, and that was making sure that we didn't get loads of supply teachers in, because that disrupts the learning. My deputy and I do a lot of teaching, and we were covering the classes just to make sure that learning was consistent and education was affected as least as possible.
Paul, well done on that. Paul Jordan is head teacher at Thames View Infant School in Barking, 11 after 8. Listening to that is John Oxford, who's a professor of virology at Queen Mary College University in London, chairman of the Global Hygiene Council, and that really is my first question, Professor. A lot of this, I sense, or indeed some of this spreading could be stopped if people were just more hygienic.
Yes, and I thought the school did pretty well, but I think one of the issues, the biggest issue, is the lack of application of hygiene. I know we all talk about it, even I talk about it, but we know from surveys we've done, in fact we've been into people's homes a year ago and did swabbing and that sort of thing in the UK and indeed in 18 other countries around the world. And the fact is the hygiene standard is not good enough.
Right.
I think it's been allowed to slip. over the last, say, 20, 30, 40 years. You see it.
What do we not do that we used to do, Professor?
Well, we used to wash our hands a lot more. It's quite simple stuff, actually. And these days, you find in the surveys that we've done, in England, for example, you find about half the population don't wash their hands more than 2 or 3 times a day.
Well, presumably they do after they use the loo.
Pardon?
They do wash their hands after going to the loo, don't they?
Well, they don't often.
Oh.
I mean, because of the hygiene survey, I always look at, say, at Heathrow. I was at Heathrow recently, in the men's toilet. I mean, you just have to see what's going on in the men's toilet, and half of them don't wash their hands.
Oh, my God.
So that's a big problem. So here, this is at the centre of it, this norovirus. There's no vaccine. There's no antiviral drug. The virus is there in quite large quantities. The incubation period, there's a time between you get the virus yourself and you get the symptoms, is quite short, 48 hours.
Yeah.
So you've really got to take some social responsibility and some hygiene action. That means washing hands a lot with disinfectant, going to the alcohol wipes. That's probably the best thing in the end to kill the thing. They're quite difficult to kill.
We should be washing our hands not just with soap, did you say, Professor, with disinfectant?
Yes, I think disinfectant soaps help a lot, and as I say, the alcohol wipes, which contain quite a lot of alcohol, you need alcohol around. You need some chlorine as well if you can, but not on your hands. But alcohol wipes are good. And I think another thing to think very carefully about is washing, because if someone in the family's ill with diarrhea and vomiting, all the clothes get contaminated, and you've got to get the temperature up. It's no good using low temperature to wash things, clothes. And it's the same with dishes. You've got to get the temperature up in a dishwasher. So all those things will help tremendously.
You know those squirty hand gels that nurses have clipped to their belts?
Yes.
They're quite good things, aren't they?
Yes, they are. Every piece of attention to hand washing and social distancing is another thing. Obviously, you don't go into the lion's den. If the family next door, they tell you the little lad's got diarrhea and is in bed, you preferably keep away from them, to be frank about it, for a few days. And one of the other problems is you usually get well. Most people don't get seriously ill unless they're elderly or very young. So in 2 or 3 days you're feeling better, but you still excrete the virus for a few days after that. So even when you're getting well, you can still infect other people.
Lastly, someone listening now who's just going down with it or has gone down with it, typically, and I appreciate different patients present different instances, but typically how long is he or she going to be hors de combat?
A couple of days, 2 or 3 days. I mean, I visited my one of my daughters, who's a doctor, and she had it over the weekend. Now, she was able to struggle on.
Right.
He didn't want to eat very much, but was able to be on 2 feet and walking around a little bit. So you can struggle on. You wouldn't see patients. You'd keep away from people. No kissing, all that sort of thing.
Right.
But, pay attention to yourself and get your hygiene level up and make sure you don't spread it to someone else.
Thank you for your time. John Oxford, Professor of Virology at Queen Mary College, University of London, and Chairman of the Global Hygiene Council. And now